Hello, I'm Burl, and this is my son Troy Silvernail. At the end of June this year, we took a trip to the Dominican Republic.
A memorial fund was set up to continue my dad's legacy of involvement in improving the health care of the Haitian population.
The decision to go to the Dominican Republic in lieu of Haiti was not an easy one for our family. However, today's political climate in Haiti does not allow for a regular return visit with work teams to make any kind of an impact.
With that in mind, we went to the Dominican Republic without any commitments or obligations to any particular organization, trusting that God would lead us to a group that would allow us to be involved and continue my dad's legacy and be true to his legacy.
We're happy to tell you that the Lord led us to just such an organization, and this is called Island Impact. We feel that this group fits our criteria and philosophy for several reasons. We would like to share some of the photos that we took and show you how Island Impact works. They work with the Haitian population, and they work with the Dominicans also. They work with the people from Haiti who have no political standing and have very little access to health care. Really, they may be better off in the Dominican Republic than they were in Haiti, but they still, as you can see, live in extreme poverty. Island Impact is also a non-denominational group. It works with anyone. It has a Christian focus, and you see Kelly Nelson, who is their nurse, and she coordinates all of the health components. Kelly will set up your team, does the logistics of transportation and lodging and translators and where the mobile clinic will be. She said if anyone wants to come and do the work, she said she feels that if they do the work and care for the people with Christ's love, that message will come through.
From a medical standpoint, there are a couple of things that I really feel good about. Island Impact allows for good follow-up. When short-term mission teams go to the Dominican Republic and work with Island Impact, they actually have a permanent clinic, the Maranatha Clinic, which you see here, that allows for chronic follow-up. In other words, patients who have medical issues that need to be followed up can be seen in this clinic on a regular basis as much as needed. They have a medical staff that sees patients. They have a pharmacy, you see here, that's well-stocked and provides medications that are needed. So we feel good about doing short-term work with them because we know that long-term follow-up is provided. It's not just putting a Band-Aid on a long-term problem. I also am impressed with their relationship with the government and the local health care facilities. Here's a picture of the local hospital in Puerto Plata, a larger city, where Island Impact work teams have worked to refurbish some of the wards. Here you see pictures of a pediatric ward that may not look fancy by our standards, but this is much nicer than it was before their teams completed their work. Here's a picture of a bathroom that Kelly's husband Rob told me was non-functional in a hospital. This work that they're doing to refurbish the bathroom will allow people to have decent toilet facilities, which are, of course, essential in healthcare. This relationship that they have with the local government and local healthcare officials allows them to have access to surgical suites, so when surgical teams are brought down, they have places to work.
Dwayne always felt that the key to improving health was to go directly and approach things from a public health viewpoint, and that was to focus on communities. And Island Impact does just that. They go into the communities. Many of them are predominantly Dominicans. Many of them are predominantly Haitian, but they go in there, and I really appreciate the fact that they hand-clasp for partnership with the local professionals. Kelly hires Dominican doctors, healthcare workers, and they set up a system that is very conducive to visiting medical teams. And we feel that this approach is directly in line with Dwayne's philosophy and our goals for this project.
The Island Impact's approach to their mission work is real pragmatic. They are focused on a limited area which cuts down on travel for the visiting mission teams. It also allows patients to have manageable travel distances as well. They don't do anything fancy. They provide basic medical care. They don't replicate services that are already provided. Here you see pictures of the dental room at the Maranatha Clinic, as well as the eye room, where they have clinics that are associated with each of those specialties. They also have a well-stocked pharmacy, as we talked about earlier.
While we were there, we were honored and fortunate to be able to connect with a medical team that was in from the United States, and that allowed us to observe firsthand how this organization works. I don't have to tell you, we were impressed. We saw Kelly and her team just so easily put together the activities. They did a fantastic job and set up the mobile clinic and all the things that happen, lodging and transportation and so forth, and that's part of what Kelly does. This mobile clinic had translators and transporters and so forth, and it just showed us that it allowed for a very good work team experience. One village that we were taken to and we had a mobile clinic in was the village of La Cienega, and Kelly asked us if we would help out that day. They anticipated a large crowd, and most of them would be Haitian. Because Troy and I both are fluent in Creole, we became an added plus to that team. Troy was able to consult without any help, and I worked in the pharmacy giving meds to the Haitians and explaining to them how to take them, because most of the team members did not speak Creole. After a long, hot day and many, many patients, Kelly took us on a walk. We went down through the village, and she wanted to show us a building. This is a building that she desires to purchase and set up a permanent clinic, doing two things, lessening the travel time for patients who are coming and also providing a continuity of care for them. She told us that she has churches in the States that have committed to helping her purchase this building and have committed to 3/4 of the cost. After that trip and looking at the community and feeling as we did that day, Troy and I really both felt that we wanted to commit to helping raise the remainder of that money. So we are committed to raising $10,000 to purchase this building, which will certainly continue to allow our project in this Memorial Fund to do what we want to do.
Our experience in the Dominican Republic with Island Impact has really clarified that we want to be involved, and we're going to be involved, and we're going to continue my dad's legacy of being involved in the health improvements in both the Haitian community and the Dominican community in the Dominican Republic. We want to partner with Island Impact and provide them with medical teams as well as medical supplies, equipment, pharmaceuticals, and financial resources.
We are excited, as Troy said, and plans are already underway. We are looking at taking our first work team next year 2009. If you are interested in any way in being involved, please get in touch with us.
We have contact information available at the end of this DVD. Please contact us if you have any interest, and we'd love to hear from you.